Hi, everyone. This is Robin Carlson with Stratus Health, and this is the CART and data submission training. If you guys have been on the other two, this is the third session in our 3 sessions of training. And Jody Winters and myself are on. Jody will help me kind of monitor the chat, and in case I, mix myself up when I'm trying to move things around, she'll help me with that. This is really informal. This is for you guys. So please interrupt me, unmute yourself if you want to ask the question out loud or put it in the chat. We probably have a smaller group today than we maybe had on the past 2 trainings, because maybe not everybody uses the CART tool. But again, feel free to interrupt me if I'm talking about something that you don't understand or you have a question. I want to kind of apologize in advance. Hopefully this won't happen, but my washing machine is broken and the repairman is coming. Not supposed to come till the window time frame is 12 to 4, but sometimes they call ahead of time to say they're coming, and if you don't pick up the phone, they might cancel. So I apologize if my phone rings, but I have to run in and get it. So forgive me in advance if that happens. So I think that's kind of all my intro stuff, and we'll get started. There will be kind of a lot of me stopping my screen share and going to another site and then screen sharing again. It's kind of really the only way I know how to do this when we're not together and doing a Zoom. So bear with me with some of that, please. Okay, so I'm going to get started by showing everybody where to find CART. So I'm going to stop share for a minute. And what I want to do, and I'm going to be talking to myself along the way. So just like, just be prepared for that. Okay, hopefully this is the QualityNet site. Jody, is this the QualityNet? Okay, great. Everybody, this is like where to find CART. So this is the main page of QualityNet. You should be familiar with that. Oh, everybody, I'm sorry, I didn't expect it to happen this fast. Give me 1 second. Everybody, I just really apologize. I'm back, and it wasn't even the tech. Okay, this is the main page of QualityNet. This is where you are going to go to be able to find a CART and the different versions. So we're going to go to hospitals outpatient. We're just going to deal with the outpatient CART today, but know that there is a separate version for outpatient and inpatient. And if you are abstracting any of the inpatient chart abstracted measures, which at this time, there is only the sepsis. But if you are, you have to make sure you install the inpatient CART. But we're just going to be talking about the outpatient today. So to find the outpatient, we clicked on the outpatient. We go under data management and the data collection tool. CART, the abstraction tool. Okay, just to show you, I'm going to check on view all versions of CART. And here are all of the different versions. Okay, my recommendation, and it always has been, and it still is, that before you abstract for a quarter, that you come here and make sure that you have the most current version of CART. Okay, now this version here, the latest version, 1.20.1, says it's for encounters starting with April 1st, 2022 to December 31st, 2022. Okay, now what this means is for that time frame, you have to have this version. Okay, but it doesn't mean you can't have this version when right now the latest quarter that's due is quarter one of 2022 is that's what's coming due in August. But you can still use this version. Okay. Now CART would tell you if it wasn't compatible with prior versions, and then you wouldn't be able to go outside of that time frame, but that rarely happens. Okay, so this is saying for this time frame of April to December, you have to at least have this version, but it doesn't mean you can't use that version for quarter one. So I would always come and make sure you have the most current version. Now, because it doesn't happen all the time, because of course that would be easier and we would know what to do. Sometimes if you don't use the most current version of CART and you're submitting data, even if it's a time frame that works, like here, this version 1.20, that says it's for quarter one of 2022 through quarter 12, through quarter 4 through December. But sometimes when they do a version of CART, they make some changes to the warehouse. And if you don't have the most current version, sometimes data might get rejected for that reason. And I can't be more specific than that because it doesn't happen all the time, but it's an occasional thing. So just to make sure it doesn't, I would always update to the most current version. Now, if you've submitted your data already and you've had the 1.20.0 version, that's fine because you would have checked to make sure your data was accepted. And we'll talk about that towards the end. As long as you've always checked to make sure your data is accepted, you should be fine. But if you haven't started abstracting yet for quarter one, make sure that you've got this most current version. Now, I don't know if you guys, a lot of you are have already had CART, you're not brand new to it, or maybe you're getting a new computer and you have to do an install, like a brand new install. There isn't a help version, an online help version of CART, and it's on this site where you've got all the different versions down at the bottom, the online help guide. I'm not going to pull it up, but it's very important to be looking at that. If you are downloading CART for the first time, if it's a brand new install on a new machine, because CART is very specific on how you have to initially log in. On this help guide, there is an initial first login username you have to use and a login password. And then the step is go in and do this and this, and then log out and then log back in with this, a real step-by-step. And if you don't follow those steps, what you could end up doing is locking yourself out before you even get started and having to uninstall and reinstall. So that's the one kind of really tricky thing about CART. Brand new install, make sure that you come and look at this help guide. Now, CART for the most part is a standalone version, okay? It's installed on your computer. Unless your IT people do a network version. And if there's instructions in the online guide on how to do a network version, so that no matter what computer you're in at your hospital, you could pull up CART. But that's again kind of you got to have an IT person that knows what they're doing. Otherwise, really, when you're installing, coming here and doing this install, it's just on your machine, okay? And so anybody who was going to enter in CART and submit would have to come on this one machine and do the entry. When you are abstracting in CART, you are the only one that sees that data, okay? Until you send it off to the warehouse, it's on your machine, it's sitting there. I can't see it, CMS can't see it. No one in the MBQIP program can see it. It's your data and it stays on your machine until you delete it. Even when you send off files to hospital quality reporting, it still is in your machine as well, unless you delete the information. So just know that it's on your machine. It's only yours. You're the only one that sees it. Okay. Any questions about that? I want to show you one more thing before we leave here. On this same page where we found the tool, there is a paper tool under Abstraction Resources. If anyone would prefer to enter on a paper tool and then do the entry into CART at another time, or just would rather, not do right into an online tool, here is the paper tool. Just make sure you're doing the right time frame for the encounter that you're doing. And then you would want to use the version that says CART after it, because then the questions are in the order that they would be in CART. So when you go to enter into CART, you can just go right along. If you do the alphabetical, then all the questions are in alphabetical order. And so you'd have to skip around to find the questions in CART. So just know that these are there. Totally up to you if you would want to use them or not. Okay, everybody good with how to find CART, want to use the most current version, and here's the paper tool. Okay, all of these things hold true for the inpatient version as well. If you were doing that, you'd want to have the most current version, and then there's an inpatient tool. It's just under the hospital's inpatient resource. Okay, I'm going to stop sharing because I want to pull up CART. Okay, and just give me a minute to find it. Let's close that. Okay, everybody. Right now. I'm talking to myself a little bit. Anybody have any questions while I'm trying to find things? Okay. Okay, of course, this worked perfectly fine when I was practicing with Jody. Okay, Jody, why can't I find this now? Okay, are you seeing choose an application? Anybody?
Yep, I can see it on the front of the card.
Okay. Sorry, everybody. This is now I'm going to log into CART. So this is where you should be. At the beginning, it's the quality management system, and I'm going to choose my application. So here I have outpatient and inpatient installed on my machine. So I'm going to do the outpatient. Hopefully. Okay. At this point right here, before I've logged in, if I did not know which version of CART I had, I could check right at this spot. Okay. And what you do is click on About Quality Management System, and this tells you what versions you have. It tells me I've got version 4.28.1 of the inpatient tool and version 1.20.1 of the outpatient tool. Okay, so before I even log in, I know, okay, I've got the most current version of CART. Okay, and just a reminder, there are a lot of things about CART that can be kind of tricky. I'm not saying the install is always the easiest, but for any of you who've used CART for a long time, the actual working of CART hasn't changed. How you set up a provider and enter a patient and do the abstraction, really none of that has changed since the very beginning of CART. Okay, the only thing about submitting data that has changed is instead of once you want to submit your files, instead of going to QualityNet, like we used to in that secure login, now we submit them to HQR, Hospital Quality Reporting. But the actual entry and everything inside of CART hasn't changed. And, just, it's not CART's fault if you don't remember your password, or, you don't have the right version. That's kind of, little bit of user error. So my user ID, I have made it so simple that I can't ever forget that. My password, no, I've written that down, but hopefully we're going to be okay. All right, brings up this, you have to accept. If you don't, you can't even get any further. So for brand new people, it's always, I think it's kind of scary. When you first log in, you get a blank screen. So you're always tempted to think, oh my gosh, what did I do wrong? But this is the screen. If ever you're logging in for the first time and you don't have these options, then, could be potentially something wrong. But under administration, provider is your hospital. Okay. So that's where you're going to have your provider. The important thing on this screen for someone, again, if you're not brand new to CART, and you've just been doing it for a while, every time you update a version, you always want to come under this provider area and make sure you've got your provider preferences set. Provider preferences, they're what tells CART what measure data you're going to be submitting. If you don't have these checked, what happens is when you get to the screen where you're picking your encounter, excuse me, and it asks you the measure set. If you haven't checked these off, CART will let you know you haven't set them. So always make sure when you're doing an updated to a version, an upgraded version, come over here and make sure that you've got your preferences set. Now, do not worry about this 1.23. That's not the version that we have. So I don't really know what those numbers are. Look at your time frame. I asked QualityNet once, the help desk, what is, this number right here? It doesn't correspond to the version. They said it's kind of something behind the scenes. I don't even think that they really knew, but don't pay attention to what's in parentheses. We've got our time period. Okay, so make sure, again, we want to be abstracting for Q1 of 2022. So we've got that right time frame. And I've checked everything. I mean, there's only 3 chart abstracted measure sets now. There's AMI, there's the ED, and there's the stroke. If you aren't doing stroke, you wouldn't have to check that off. I just kind of think once I'm in here, I check off everything. It doesn't matter. It would just mean if I ever wanted to start abstracting stroke, I've checked it off so CART knows, hey, you could abstract stroke if you wanted to. But you need to make sure for the MBQIP program, you're doing the AMI and make sure everything is checked, and the OP 18, the ED. Okay, then you always want to make sure that you save those. I wish there'd be a save button, but the save is always the little floppy disk thing. Okay, so that's the important thing, really. Once you get set up, initial setup, you've always got your hospital in there, but it's coming over here to check on the provider preferences. Again, anybody stop me if you have a question or put it in the chat, please. Okay, so again, under administration as a user, that would be whoever is entering data. Okay, make everybody a system administrator. Then they can do all of the functions. And don't worry about, you can have 2, you can have 3, it doesn't matter. Just if you're adding someone, just make them a system administrator. Because if by chance you locked yourself out, maybe you forgot your password or whatever, if you had someone else who was a system administrator, they could come in and help you reset. Okay, I'm the only one who's entering on my machine here, so it's just me. I'm the user. And patient, that's where we want to start abstracting a patient. This is the first kind of demographic stuff we're going to enter. And once you put in a patient, this information here, kind of the demographic stuff about a patient, that patient is always there. You don't have to enter it again, that patient. If there's no other system administrator and you get locked out, you have to call the, excuse me, you have to call the QualityNet help desk. There is a way, and I don't know the particulars, that they might be able, that they can help you get back in, and you can reset your password, rather than maybe uninstalling and reinstalling. So that number for the QualityNet Help Center is on that main page of QualityNet. Okay, so here's all my patients that I have ever entered into here. So if you've got a patient who you know has been in before, you can come up here and I just did the search because I don't have a ton of cases in here. You might have a lot, because remember, as I said, your cases are in here until you delete them. Your patients would always be in here unless you wanted to delete them. But you can search by name or condition to maybe pull up the patient that you want. So unless it's a new patient, if it was a new patient, you would add a patient. Okay, they're not there. If you try to add someone who's already in here, CART will let you know. Okay, so let's just say I'm already in here. So I'm in here and okay, I'm going to add an abstraction. So I want to do add abstraction. The encounter date, okay? Let's do one that's a Q1, because that's what's coming up. And I'm going to be terrible at entering because I know you guys are watching me, and so I'm always terrible. I tend to tab, excuse me, when I'm going down into CART, because it's a weird thing in CART, but sometimes CART will skip around. So I tend to tab, but you do, you know, what works for you. And this would be unable to determine if there was some chance you couldn't determine the arrival time. That's the UTD there, is unable to determine. Measure set is okay. Okay, not supposed to be blank. Oh, I know what, because I entered okay, that was on purpose. See, it's blank because I entered an encounter date that is incorrect.
I was on the phone with Evercore and hit 0 and it rang 2.
Okay, so my measure sets, all right. Which measure set was this person? I'm going to do an AMI. Okay, so again, these are here because my preferences, my provider preferences were checked. So I'm going to do AMI. The abstractor is me. If you had more than one abstractor, you would have options there. The abstraction date always gets filled in for you. It's today. So I'm just going to tab down till I can finish. Okay, so I click on finish. And now it will bring me to the data entry screen for my actual questions. Okay, tells me I'm in the AMI. The first question for abstraction is the same no matter which measure set you're doing. Would you like the questions to be enabled or disabled appropriately per the measure algorithms, or do you want all questions enabled? You always want to enable disable questions appropriately because you want to follow like the skip patterns when you're doing this. And by that, I mean, if it asks you for a date, or say it asked you if there was an EKG done and there wasn't, okay? So then you don't want to answer the questions for date and time because there wasn't one done. But if you said enable all questions, that means every single question has to have an answer. So even though there wasn't an EKG, you would have to put something for date and time because you said you were going to answer all questions. So always follow the skip patterns. It just makes the abstraction more easier. Why do you want to answer questions that you don't have to? Okay, and then it asks for the E&M code. So whatever E&M code it was, let me give you a little tidbit here. It doesn't say this anywhere, okay? This is just knowledge from years of doing this. And I'm not trying to say that you don't want to be correct, okay? But whatever you put for this E&M code, really the E&M code in abstraction here is just to show that was a patient seen in your ED. That's all the E&M code is used for here. It really doesn't play any part in whether you pass this measure or whether the patient passes the measure or whatever. It's just to show that they were seen in your ED. Okay, so we'll say it's this one. What was the patient's code for the outpatient setting? Okay, so when they left your ED, where did they go? Okay. Okay, now, my answer, I said home. They went home, okay? CART's telling me the response given for the discharge code is not included in the hospital outpatient population, okay? Which means I'm entering a case that I don't have to enter because it's not one of the population requirements, all right? So CART lets you know if you're entering something that you don't have to. But you know, you don't want to really get to that point. So that's why it's always really important to follow those population requirements. And this is an AMI case. And everybody should remember the population requirements, the discharge requirements, the patient has to be sent to an other acute care hospital. Okay, so that should let me go now. And it is. You'll see first it popped down to number 5. But we have to do number 4, so it's kind of slow on the uptake. Give it a minute. So what was the ICD-10 code? Okay, so I'm going to put in the principal diagnosis code and see as I start typing, it brings up the codes. Okay, because all of the codes are listed under here, every ICD-10 code. So it brings me up the grouping. And then I have to come over here and pick, well, is a specific one I wanted there. And I was gonna, this person had the I-213. So then I can click on that. Okay. What is my payment source? Medicare or non-Medicare? Well, what if I wasn't sure? Well, say this person had some advantage, Medicare Advantage. Well, where does that fit? The question marks at the end of the question bring you to that instruction page in the specs manual. Okay, so if you didn't always want to have that data dictionary part up when you were doing the abstraction, the question marks always bring you to that page. And this would tell me, oh, included here, included in Medicare would be any Medicare Advantage. So that would be, I would want to check sources Medicare. Okay, then I'm really getting to the questions now that pertain to the measure. Is there documentation of ST segment elevation on the ECG performed closest to emergency department arrival? I want to show you guys why, if you were on the abstraction one, the session 2, this is an important question for this reason. How you answer really determines if you have to answer other questions or not. Because look at here, if I check yes, okay, then it's asking me about was there fibrinolytics, okay? But look, if I check no, okay, all the other questions around AMI are grayed out. And I'm just going down to my physician identifier. So, you know, again, you always want to answer these questions correctly, of course. That's the purpose of abstraction. And we want to, you know, we want the hospital to look correct on whether these patients pass the measure, fail the measure, whatever. But you'll see the importance of this question because it really depends on if we have to answer the rest of the questions or not. Now, just for time's sake, I'm going to say no. But note, if we said yes, then we'd have to go down and answer the rest of the questions. Okay, all the rest of these are light grayed out till my physician identifier. Now, the physician identifier, that is just for you. It's if you want to identify the physician who saw the patient in the ED. because maybe you want to run a report at some time on certain physicians, but nothing that you put in here gets, this doesn't get sent to CMS. It doesn't show up in any data other than a report that you might want to run. Okay, so there's no concern that this information is going to go anywhere else. And you can even leave it blank if you wanted. Because again, it's just for you if you want to do it. But you can put in numbers, like if your physician has a number, or you could put in letters if you wanted to just put in their initials or any characters, however you want to fill that out. Or if you don't want to fill that out, that's up to you. So I think I've done everything. There's nothing here that is saying that I didn't finish that. If there were some questions that needed to be done that I hadn't done, they would be up here in bold. So I think I'm done. So I'm going to save. Okay. Now it's asking me, it says it's complete. So I know I've answered everything I have to, and it asks me if I want to duplicate this record. The reason you might want to duplicate it is because I just did this case for the AMI, but maybe there's another measure set that I could use the same case for. Okay. And if you think back to the other measure set, like ED throughput for OP18, the only requirement, population requirement, is that they were seen in the ED and have an E&M code. Well, this patient was seen in the ED and they have an E&M code. So heck, I've already got, I've got this case out. I might as well do it for the ED. So yeah, I want to duplicate this record and do the ED. So I'm going to say, okay. So what CART does then, it brings me back to this spot where I'm checking the measure set. And it's already got my encounter date because that's the same. My arrival time is the same, but now it's asking which measure set do I want to do? Well, I'm going to do the ED. Okay. So I'm still abstracting. It's still this date. So then I click on finish. And it takes me to the ED abstraction. And all of the questions that are the same that I answered in the AMI, they're already answered for me. I'm going to enable disable questions appropriately. I've got my E&M code. This is where they were discharged to. This is the principal diagnosis code. So I'm going to start with the questions that just pertain to the ED abstraction. So what's the date the patient departed from the emergency department? Oh, why am I in like the year 2000? Geez. Okay. So that's my date. What's the time? Okay. And it's got my physician identifier. Okay. So it's not showing anything. I just didn't do the second physician identifier because I don't have one. So I think I've gotten everything. So it's complete. So I've answered anything. Now, again, it's going to pop up and say, do I want to duplicate it? Well, no, I don't, because I've already done the AMI and I've done the ED. So I'm just going to say cancel. Okay. Now, if you're wondering up here under patient details, well, what is that? This will tell you how this particular patient did on the measure. And this one is a timing measure. So, the patient is excluded from this one because this is for patients who had a psych or a mental health diagnosis, and they didn't. This patient had an AMI diagnosis, so they wouldn't be in B, so they're excluded from that. C is if they went, did I get that right? Oh, and transfer. And this one would be for discharge patients that were transferred. So they're excluded from the B and C. You don't have to worry about that. So then the time is, the overall time was like 160 minutes. So if you ever want to know how the patient that you currently entered did on the measure, you could always check under patient details. Okay, so I'm done with that patient. I did it for the 2 abstractions. That's okay. So I just canceled out and I'm back to my main page And this would just be where I would want to add another patient. While I'm here, let me show you, this is another spot. Remember when I showed you before logging in, how you would know what version you had? You could also, once you're in case maybe you didn't check before you got in, if you go under help and about quality management system, this is the box that pops up. It's the same one that popped up before, but it tells me again what version of card I have. So if you're not you didn't think about that until after you logged in, that's another way to check. Under reports, these are the different reports that you can run on your data that you've entered into cards. Okay. For lack of time and because I don't have a lot of patients in there, I won't go over all of them, but that the cart users help guide that I showed you, that will give you information about what all of these different reports are. But this is your data, it's just what you've entered. But you could see maybe for measure failures. And it would your provider is your hospital. And then what measure set? Maybe you want to know, how are you doing on your AMIs? Are they failing? So you can put in your encounter dates and run a report. If you wanted to run a report by abstraction detail, that's just how you've answered the abstraction questions. So it's probably around the kind of different measures that you would really want to run a report by, and see where you can do it by physician if you were putting in physician numbers. But remember, this is your data. So anytime you enter into cart, you could run a report. You wouldn't have to necessarily, you wouldn't have to wait until you got the MBQIP reports. Now, MBQIP reports has the information in there around benchmarking and comparison to others. But this would be, if you wanted to run a report on your own data, know that this information is here and you can play around with it at any time. It's just your report running for yourself. So when it's time that you want to submit your data, okay, so we want to look at all of our abstractions. I'm at the abstraction page. And again, if you've never deleted anything, all of your abstractions from the beginning that you've entered are going to be here. So you maybe don't want to do the search. I don't have a lot of things in here. That's why I'm doing that. But you would probably want to maybe do search criteria. Do you want to run it by a certain date or time or condition or value or whatever? But again, if you wanted to do search and then just do it, put your dates in alphabetical order, or excuse me, in date order, you could do that as well. But here are all my abstractions. Okay, so you notice that bugs was in here several times. I've had a couple. Okay, your abstractions are going to be here unless you delete them. Okay, and it depends on how you want to keep them. I mean, if you're someone who runs reports on them, maybe you want to keep them forever. If you want to keep, I mean, I would definitely keep I wouldn't, probably I'd keep 2021 even, maybe just in case. But it's up to you how long you want to keep. I would never delete anything until after a quarter due date has gone by, because in case something happens, you want to be able to come back here and resubmit. Okay, but here's all of your abstractions. And this is why you're going to see the patients, like I said, more than once, because if they've been in more than once, they'd be listed here more than once. So let's say I want to submit my data now. I've abstracted for the quarter, or I abstracted and I want to submit some data. You come to this page and you highlight what you want to submit. Okay, like say I was going to submit I was going to submit these. I've highlighted what I wanted, and then I'm going to export these cases to wherever I want to put them on my desktop, in a file, wherever you want to put them, to then submit to hospital quality reporting. Okay. Now, it's kind of a spot where I can't really go any further here because I don't have the access. But just to let you know, anybody maybe who's new to CART, CART is where you enter the data, and this is where it is, but it's not the end. Okay. Once you have to then take the files that you want to submit, for the measure, export them to wherever you want to, and then we're going to get out of CART and go to hospital quality reporting. Okay. So this is the screen where you're going to do that. Okay. The abstractions, where all your abstractions are. Highlight what you want, and then we're going to export. But this would also be where maybe I want to change something. Maybe I didn't do something right. Or maybe this didn't say complete and it said pending. This is always the same where you can come in and you can edit the abstraction, or you could delete it if by some chance maybe you entered something twice or something was wrong. This is where you delete, and it doesn't delete the patient. This would only delete the abstraction information. Okay. Edit abstraction would be if I wanted to answer, maybe I thought I answered some questions wrong or something. Okay. Takes me back to there. Okay. But again, I'm ready to submit my data. If I use the CART tool, I come here, highlight what I want to submit, do export, and then it will ask me, okay, where do I want to put these? Where do I want to put these? Okay, and then I'm done with CART. Anybody have any questions or anything I can show them in CART that maybe I didn't? Everybody good with that? Okay, I'm going to get out of CART. I'm going to close CART. I think there's a couple different ways to do it. Exit. It usually asks you if you want the database to be archived. I always say yes. No one's ever really told me what happens if you say no, but I don't take that chance, so I say yes. Okay. So I'm out of CART. All right. Now I'm going to stop screen sharing for a minute. And I want to pull up okay. Now, you guys, I don't have, and I apologize because anybody who's probably heard me talk before has heard me say this. I have a HARP account and I can log in, but that's as far as I can go. I do not get any of these options. So I just want to be able to show you where you would go once you're going to submit your data. But the first step would be, okay, I highlighted those cases in CART. I exported them to where a file folder or my desktop, wherever I wanted to put them. And then I'm going to log into my HARP account. If anybody doesn't have one or they're not sure what I'm talking about, contact me after this and we can discuss it. But that's the next step in submitting your data. You have to log in to what CMS now calls hospital quality reporting, HQR, and you should get this page and you should get these options. Okay, so get your files in CART that you want to submit, put them somewhere, remember where they are, log into your HARP account, and you come here. So you want to submit your data. You're going to go under data submissions. When you click on data submissions, this is the screen that comes. Now, I believe this is still what it looks like. If anybody knows that these screens have changed, let me know. Because again, I don't have access, but I don't think anything's changed here. The thing you have to be careful of, it initially goes to the ECQM abstraction. And we're not trying to submit ECQMs now. We're talking about our chart abstracted data. Okay, make sure you click on the tab of what you're trying to do. Okay, if you were going to do that web-based measure, if we were back doing OP22, that would be that. If we were going to do population and sampling, we click on that. If we're going to do chart abstracted data, we want to click on that. Okay, make sure you do that because it will let you submit data under here. People have done it and their data was rejected and they didn't know about it because they didn't check. They didn't run a case data summary report and their data came up with nothing on the MBQIP report. Now there's a structural measures tab. Okay, great. I think at the time that maybe we were doing this, they didn't have structural measures for outpatient, but they're, so thank you for adding that. I appreciate that. Okay, so make sure you're on the right tab for what you want to do. If we were going to do population and sampling, and I always recommend that because it will make sure your MBQIP reports are accurate. You want to do data form and OQR because we're doing outpatients. This is what the screen will look like. You'll have different reporting periods, but you're going to start the measure. You would say, are you sampling? That would mean you're not doing all your cases. You're just doing a sample size. Not sampled means you're doing all of your cases. You're not sampling. And you wouldn't do submission not required because ED throughput is required. Okay. All fields must be filled in. So there's no blanks. You got to put in a 0 if you're not doing anything here. Your population is your population. For the quarter, how many cases met the population requirements? Okay, so you always know this. You always know this number because that's how you know which records to do. Your population is for the quarter, how many cases meet the population requirements? Those are your numbers that go in here. It asks you by month. It asks you to split Medicare and non-Medicare. Don't worry if that's not exactly correct. The most important thing is that there's numbers in here and the total. Okay. This is a CMS thing. Because back when CMS only knows about Medicare claims. Okay. So CMS would know what your population should be for October on Medicare claims, but they don't know about non-Medicare. So they used that number to be able to tell if you were submitting the right number of cases, at least the right number. But critical access hospitals submission is voluntary for CMS, so they're not looking at this for you. If you were a PPS hospital, this needs to be very accurate. Again, I'm not saying you don't want to be, but if you had 10 Medicare and 5 non-Medicare and somehow it was 9 and 6, nothing of that is going to matter. Okay, it's just we like you to fill this in so you don't forget to fill it in. So population is everybody that meets the requirements. Sample, how many are you actually submitting? If you're doing all of them, your numbers here are going to be the same because your population is everybody. You're doing them all, so your numbers are the same. Okay. If you're sampling, your population number is everybody. Your sampling would be the number you're actually submitting. What is your sample size? Okay, if your population is 50, but you're sampling 25, 50 would be up here, 25 would be down here. Okay, does that make sense? If you don't have any to submit, do you pick not sampled? Yes, okay. If you, for AMI, and that's what happens sometimes for AMI, maybe you have no cases that meet the AMI requirements. So you would pick not sampled because you're doing them all if you would, and then you would come in here and you would put zeros. Okay, my population is 0. I have no cases that meet the requirements. My population is 0. My sampling size is 0. Everything is 0. And then your MBQIP reports will show that. There'll be an asterisk there under AMI, under the OP2 and 3 instead of the NA. Because an NA just means there's no data in the warehouse for you. And when I see that, I don't know, okay, does that mean they didn't have any data? Does that mean they didn't do any submission for the quarter? So your report would be accurate if you filled in this population and sampling. You wouldn't have to have a call from me saying, what happened last quarter? Great question. Okay, so that's population. Then come back, make sure that you have saved and returned. It bring you to the next one. And you should get this bar across. Population and sampling measure set successfully submitted, if you've submitted successfully. Okay, so back to our chart, abstracted data, our cart files. Okay, we've got chart abstracted. We're still under data submission. We want to do production. We don't want to do a test. I mean, maybe you want to do a test to make sure data got submitted, but then you still have to come back here and do it under production, because test data is not valid data to them. If you didn't come back and do it under production, your data would be rejected and it would be like you had no data in the warehouse. So chart abstracted, production, you get this screen, okay? You wouldn't have anything in here right now. It would be blank here, but you would click on select files. Then it would bring up your desktop or your files. Find that file where you put your cart files. Click on that and they will pop up here. Okay. I don't want to say it's as simple as that because maybe that's not simple. I mean, I'm not a great person with files and whatever, but that's what you do. Okay. Remember where you put those cart files, click on this, pull them over, and that's that. Well, it isn't that, because there's one more step that you should do. This is really great to see that they were accepted and received. I don't let that be my final say, because I'm kind of a doubter sometimes when it comes to this. So what I would then do is come over here under my dashboard, go to data results. Okay, under data results, okay. I want chart abstracted because I want to check on my chart abstracted, what I've just submitted. Okay. I want to know if they were accurate. Okay. Did the things get there? All right. I'm going to do OQR because I'm on outpatient. I'm going to run my case data summary report. Now, there's a lot of other reports you can run, but I only want to know right now. I'm checking. The only thing I want to know, did my cases get to the warehouse? Were they accepted or were they rejected? I only want to know that information. So I'm going to run a case data summary. And then I select my quarter and click on this. And a report will run up, and that's the only thing it tells you. How many cases got to the warehouse and how many were accepted and or rejected. If you run this report and nothing comes up, then there's no cases in the warehouse for that quarter. Something happened. If you run this report and it says some cases were rejected, come back here and run the submission detail. Submission detail report will tell you why the cases were rejected. And then you could go and make those corrections and resubmit before the data was due. Okay, I would always come here and check because I don't want to be doing all this work for nothing. So I'm always going to run this report, and now it pulls up really quick. It's not like back before we had this HQR system where you try to run a report and sometimes you wouldn't even get till the next day. This pops up pretty fast. Okay, and I think you can really check it almost right after you're done submitting. Okay. So any questions about that? I know I went through this kind of like fast, but wanted to make sure it had some time for questions if there were any. Anything in the chat? I think I've been answering. I don't see anything new. Looking through my notes, see if I forgot to say anything. Next set of data coming up is Q1 for 2022, and the population sampling and outpatient measures are due on August 1st. Any questions about CART or submission? How to find the versions, provide preferences, entering a case. I'm just going through my notes. That was really everything I was going to talk about. Anybody have any questions from any of the other trainings if you were on those? What we'll do is, I don't know, either later this afternoon or tomorrow, Jody will give you, Jody will send you an email with a link to the evaluation. And we really appreciate you guys filling these out. You know, they let us know if you think that these were helpful. If, you know, there's something that you think you'd like to go over that we haven't, or they could be longer, they could be shorter. We really appreciate you filling out that evaluation. And then we'll do another little quiz again. I really like to I mean, there are only about 10 questions or whatever, but it helps me to know that I think I've, you know, the things that I think I wanted to make sure that I got across in the training, that I hope that I did. Yes, we did record these sessions, and we were waiting until all 3 of them were done. But we will, we have to get them set up on our system. But there will be a link, and I think they'll be on our, and Jody, correct me if I'm wrong, they'll be on our Stratus Health, like Critical Access Hospital Flex webpage. But I think we'll be sending you a link to that. So all 3 of these sessions will be, were recorded, and we'll make those available to everybody. Anything else? Kind of, Jody, anything that I forgot to maybe say, or?
No, I don't think so.
Okay, here's our, Jody sends out the emails, even though sometimes, you know, maybe it's coming from me, but Jody can do them in the batches to everybody. So if you send things to Jody, it's fine. Jody will always forward it on to me. Or here's my email if you want to send me something directly. So either way, it will get to me. Jody is the one that would be able to help you if you can't get in to see your MBQIP reports or anything around that. But again, whichever one of us you contact, we will certainly get that information to the other person. And one last 4 questions before we go. Okay, that's it. Thanks again, everybody. I really appreciate your time. Hopefully these, you know, that you found something valuable in these sessions. And again, we appreciate you and all that you do, and fill out the evaluation if you have time. And please do the quiz if you get a chance. We'll give you like a week to get those back. Thanks, and have a great rest of the day, and a happy 4th of July week. Oh, somebody in the chat. Oh, yeah, thanks, Melissa, I appreciate that. Have a great 4th of July weekend, everybody. I wish it wasn't just Wednesday, but we've only got a couple more days. So thanks a lot, and talk to you soon. Bye.